Today we discuss briefly ketogenic diet, epilepsy and seizures. We learn about how a low-carb, high-fat keto diet can reduce occurrences of seizures and help treat epilepsy. While a majority of people follows the keto diet for weight loss, epileptic patients use it to significantly ease their everyday life. For many years now, a specific version of a ketogenic diet has been proven effective for treating epilepsy and helping those suffering from this disease. Children who have epilepsy and suffer from seizures not controlled with anti-epileptic drugs can apply a therapeutic ketogenic diet as a possible treatment. Even though the mechanisms are not understood completely, the science behind ketogenesis works in altering the brain's metabolism in a certain way that possibly reduces the risk of having seizures. We will discuss the therapeutic ketogenic diet for epilepsy and seizures to understand it. While most people today start the ketogenic diet to lose weight or otherwise improve their health, the eating strategy originated as a treatment for epilepsy. The research story begins with the first modern study of fasting and its role in epilepsy, which took place in France around 1911. The study found that epilepsy patients who consumed low-calorie diets combined with periods of fasting experienced fewer seizures and had fewer adverse health effects from the condition. Around the same time, an American osteopathic physician named Hugh Conklin began to recommend fasting to his epileptic patients to help them get their seizures under control. Using a method that caused epileptic patients to fast for 18 to 25 days at a time, he boasted a 50% success rate for adults, and as high as 90% for children. Depending on the severity of illness, ratios of the diet may be modified to suit the individual. Studies are currently researching high-fat consumption for treatment and prevention of illnesses such as epilepsy, Alzheimer's, Parkinson's disease, dementia, and other neurodegenerative diseases. At first glance, these strict ketogenic results were impressive. However, there was one glaring problem. While researchers had proof that fasting could control seizures, the obvious complication was that fasts are meant to be temporary. Many patients found that their seizures came back once they returned to their regular diet. As other doctors began working to replicate these results, some experimented with modified fasts that focused on eliminating starches and sugars, rather than restricting all calories equally. Specifically, Dr. Wilder at the Mayo Clinic observed that certain epilepsy patients had fewer seizures when their blood sugar was lowered from eating a high-fat, low-carb diet. He consequently created the ketogenic diet as a way to mimic the metabolism that fasting produces. While there were plenty of cases where the ketogenic diet proved successful in 1938, with the discovery of phenytoin, an anticonvulsant drug, the focus shifted to developing new compounds of this kind. Hard to believe that doctors would rather prescribe a drug versus having patients maintain a nutritional regimen. To be fair, the world was a different place in the late 30s. They had a global crisis of their own and they were just entering the wonder drug era. However, there was more money in selling monthly medication prescriptions than prescribing a diet, a paradigm that still exists today. The bottom line: epilepsy is a condition that is considered as extremely debilitating. It can even negatively impact the quality of life. Even though medications can be used, the implementation of a ketogenic diet plan for epilepsy plays a vital role in this regard. The issue of epilepsy happens as it has something to do with how our nervous system utilizes the energy within our body. As such, it uses a huge amount of energy for our nerves and brains to properly function. But because of this therapeutic ketogenic diet, kids who have problems with epilepsy no longer have to go through a fast. A good ketogenic diet meal plan for epilepsy, together with the availability of substitutes under the low-carbohydrate category, makes life easier and better for people who are suffering from epilepsy. Learn and understand more on keto diet. Follow the link in description to access more keto diet resources. Try keto today.